Today, I want to introduce Kavithra Karalasingham. She's a PhD student in the lab of Dr. Satish Raj, and her research interest is in postural orthostatic tachycardia syndrome. Kavithra's work aims to identify the cause of chest pain in POTS using cardiac magnetic resonance imaging. Kavithra is the LCITO, the Libin Cardiovascular Institute trainee organization, community outreach and women's health lead. So welcome, Kavithra. I hope you're doing well today.
I am.
Awesome. So I'm just going to jump in with some questions because people probably have no idea what postural orthostatic tachycardia syndrome is. We can use the shortened version, which is POTS. So what is POTS?
Yeah, so POTS is a rather rare disorder, I would say. There is more recognition now, I think, with a lot of the work that we're doing, but it is an autonomic disorder, and it's specifically characterized by an increase in heart rate by at least 30 beats per minute when you're standing up. And POTS is not associated with the drop in blood pressure, so it's just that increase in heart rate. And they also experience a lot of symptoms while they're standing as well. So this can include lightheadedness, blurry vision, shortness of breath, chest pain, brain fog, and there's a whole plethora of symptoms.
Wow. Who does this disorder affect?
It is mostly younger women, but we have seen older women with it, and there are males with it as well. It's about 5-to-1 ratio of females to male.
Right. And is there a specific age group of people that it would impact?
We would say typically onset is pretty young. So 15 to 25 years is when people typically first get POTS. And then, at least with the patients that we see, like the average age is about low 30s.
Do we know what causes POTS?
So there's a bunch of theories, but we don't have one specific cause. So it is most likely a whole bunch of different things. One thing that we've seen more recently was actually post-viral infections. So we had a lot of patients after COVID even that had symptoms of POTS that came into our lab, did some testing, and met the criteria for POTS. Some other interesting things are even just like different life events, such as like puberty or even surgeries or other infections. So some physical event seems to be a trigger for a lot of people.
Wow. So you kind of alluded to this previously. You talked about some of the symptoms that people can have, but how does it impact a person's quality of life?
So even though POTS is, it seems like it's really just a standing disorder. If you think about it, how many times you stand in a day or walk in a day. So it does actually affect you a lot more than it sounds like initially. Like we've had previous studies say that the quality of life in POTS is actually comparable to patients with congestive heart failure, which is a lot. Um, I think another important thing to note is that not all the symptoms actually go away when you sit back down or lie back down. That's something like my project's even looking to. Like initially, it seemed like chest pain was something that was onset upon standing and seemed to get better when lying down and sitting. But then after talking to more patients, we realized that it actually can last quite a long time in people. Like some people say it'll even last overnight or like a few hours after the initial onset. So there are lasting symptoms in these patients.
Wow. So on a day-to-day life, I'm thinking it might stop you from like even going for walks, or if you're a parent, because it's kind of the age of parenthood,
Mhm.
that might impact how you can take care of your kids even. Wow.
Oh yeah, yeah. We've had patients say that where it's quite sad to hear actually, because they'll be like, I wish I could be like a better mother, but I obviously know that they're trying their best and they just have their limitations physically sometimes.
Wow. So this is sort of your area of research. Can you tell us a little bit more about what you're doing with the chest pain?
Yeah, so one of the big things I'm trying to do with chest pain is trying to figure out what's actually causing the chest pain. Because right now it's almost like a check mark for POTS. We're like, okay, you have chest pain, that's a symptom of POTS, and it doesn't really get addressed further because we don't know what's actually causing it. So one thing I'm looking at is the common reason for chest pain typically, and that's going to be abnormal flow in the little vessels of your heart. So we want to see if that's the same reason in our patients as well.
Wow. Does chest pain impact every single POTS patient, or is it selective?
No, actually. There's actually very limited studies reporting on the prevalence of chest pain in POTS, and that range is quite big. Like I've seen like 30 to 70%, which is a huge range. So not everybody, but a good chunk of patients experience chest pain.
So, I'm thinking, if you felt chest pain, you might kind of jump to the conclusion that you maybe have a heart attack or something really wrong with you. So, why is your work important, kind of distinguishing whether it's POTS or
Mhm.
a heart condition, or maybe it's both?
Yeah, definitely. That's a very common fear of a lot of these patients when they initially start experiencing it. Like, can you blame them? Like, usually chest pain is associated with heart attacks. Um, but talking to a lot of these patients, what seemed to alleviate that fear was actually any form of cardiac testing that they got. Like, they have had like echoes done or MRIs done, ECGs done, and just repeatedly seeing that there's nothing abnormal in them let them to kind of accept that maybe this is just a symptom of POTS that I have to deal with, which is good and bad. Good in the way that they're no longer anxious about that chest pain, but bad that it doesn't get addressed and it still affects them nonetheless. So I think where my project comes in is both of those things. It provides reassurance with the MRI scans that we do to make sure that we don't see anything major in these patients. And then by looking at that microvascular flow, also trying to rule out if that is causing chest pain in POTS, because if that is the reason, then we can provide medications to alleviate that abnormal flow.
Awesome. What is the next steps for your research project?
Great question. We are getting slowly to the tail end of it. Um, we've recruited a lot of patients for this study. So it was 40 patients with POTS and 10 healthy controls. So we're slowly wrapping up recruitment now and trying to ramp up that data analysis to really answer all the questions. Chest pain is one big question, but other things we're looking at is even just the general heart health in POTS because even though these patients are very young, you would assume that they're healthy due to their age. You never know if their heart tissue is actually healthy, given that they experience these fast heart rates. So we just want to make sure that their heart tissue is healthy and we're not seeing any inflammation. So that's another thing that we've been looking at. One more thing is that these patients experience symptoms when they're standing, right? So when you're lying down in an MRI, you would expect them to probably look relatively normal because you're not standing. So we actually use this cool machine called a lower body negative pressure chamber, and that essentially simulates standing while they're lying down. So that allows us to look at their hearts when they're actually symptomatic in the MRI, which is pretty cool. And we can see if there's hearts are still looking healthy or if there's any abnormalities in that chamber.
Amazing. So, just wrapping up today, what is the favorite part of your research?
Um, Great question. There's a couple things that I enjoy about it. I think one thing is really seeing the data at the end and trying to find an answer to these big questions. Because I think going day to day, it doesn't actually seem like you're trying to figure out this big thing when you're just looking at one person's data or doing one person's study. So looking at the big picture in the end is always nice to be like, okay, like we did something, we're trying to answer this. Even if the answer is, oh, like there's no difference or isn't what we thought, that's still an answer at the end of the day. Um, Another thing I really enjoy is honestly talking to all these patients and hearing their stories and seeing how meaningful our work is to these patients as well, which makes sense. They would not put themselves through these study days if it did not matter to them. But to really hear it from them is definitely inspiring.
Awesome. Um, if you could have anything that you wanted to help these patients, you know, what would you do?
I think the biggest thing is having more people know about POTS because every time we talk to one of these patients, they're like, I went years without knowing what it was, or I've seen so many different people from like a neurologist to nephrologist and so many specialties to finally realize, okay, like someone tells them that this is POTS. And even though there's still so much more to go in terms of helping them and finding the right treatments, I feel like that's definitely a really good starting point for patients because then they know what to look out for. They know what to look up on when they see, okay, like I have POTS, what can I do about it? So if we can alleviate the time that it takes for patients to get to that point, that would be great.
Awesome. Well, thank you so much for
Mhm.
talking about this today. You're very knowledgeable, and it's really neat to see how you're interacting with patients and hearing their stories. So thanks again for doing this.
Anytime.
Awesome.